stress. This is a joint project of the University of Iowa Department of Psychiatry, the University of Iowa Hospitals COPE team, and the U of I Employee Assistance Program. Today's program was recorded on March 31st, 2020. We plan to offer twice weekly programs on a number of topics related to stress management. I'm your facilitator, Dr. Laura Fuller, Director of the Psychology Division in the Department of Psychiatry. The plan for today is for our presenter to share helpful information with you, the viewer. Further resources will be available on the hospital website. The topic for today is using mindfulness to cope with acute stress. Many of us are experiencing a level of intense stress that feels surreal at this time and difficult to manage. Today's program will give you ideas for how to use mindfulness skills to manage intense stress. I am excited to introduce our speaker today, Bev Klug, MA, and licensed marital and family therapist. Bev is the director of the Mindfulness Program at the University of Iowa Hospitals and Clinics. These mindfulness programs at UIHC started more than 24 years ago, and over the years, over 7,000 people have participated in the mindfulness-based stress reduction and mindfulness-based cognitive behavioral therapy programs, as well as follow-up programs and an academic course for undergraduates. All are available to faculty and staff at the hospital and university, as well as the wider community. Faculty and staff may access these programs at no cost through UI Live Well. The popularity of these mindfulness programs is one type of evidence that they are helpful. I certainly have enjoyed my participation in the MBSR class that I did a few years ago. We also know from decades of research that mindfulness has many benefits for people's mental health, physical health, and life satisfaction. These are positive results that have shown up in study after study. Here to tell you more, without further ado, is Bev Klug.
Thank you, Laura. I appreciate those words, and thank you to all the people behind the scenes here, our tech support people and administrators who helped to make this happen. So it's a pleasure to be with all of you, even though I can't see you but you can see me. So here we are together. I'd like to start with some mindfulness practice. So I invite you, wherever you are, to just stop, if you can, what you're doing. And whether you're sitting down or standing up, or even if you're walking, stop if you can, but if you can't, keep walking. And just bring your attention to the bottoms of your feet. And you can do this as I guide you with your eyes open or closed. I'm going to close mine. And just feeling the sensations that are here at the bottoms of your feet right now. And if they're inside shoes, you may feel the sensations of the shoes around the foot. Maybe you're barefoot. And as you feel the bottoms of the feet, and it's your intention to be aware of these sensations, you've probably already noticed that your attention went other places, even in this short time. So when you notice that that happens, just bring them back. Bring the attention back to the bottoms of the feet. And doing that really gently, and as you do so, knowing that it's really common. The mind is very busy. And it's helpful for us to know that and have some ways to respond to it that are helpful. So sometimes just bringing attention to a sensation in the body is really helpful in bringing us back to where we are and what's actually happening right now. So, shifting the attention for a moment to the sensations of the breath at the belly. And you don't have to breathe in any certain way or try to control the breath, the body's breathing. So, just feeling the sensations. And with the next in breath, seeing if you can begin at the very first sensations of the in breath and feeling it all the way through to its fullness and where it transitions and becomes the out breath and feeling the sensations of the out breath. And just doing this a couple times on your own. And you're not trying to get anywhere or accomplish anything. You're not trying to relax or empty the mind. You're just feeling this breath right here. And now, if your eyes have been closed, you can open them and shifting the attention back into wherever you are. And so, this is a little taste of mindfulness that we just did. So, mindfulness is being aware and present with what's actually happening. And oftentimes, we're not aware and present with what's actually happening. We're anticipating what might happen next, or what we need to do on that to do list, or how we're going to solve something. Or in these days, the attention is oftentimes on what's going to happen. We're feeling anxious and scared and uncertain because we're living in a world pandemic and we've never done that before. So um, it's really uncomfortable and scary. And we'll talk more about that in a minute. So the practice of mindfulness is being aware and present with what's here and also developing attitudes of how we relate to what's here. I invited you to be just accepting of whatever was on the mind or what sensations were here in the feet or the breath. Um, and we do the same with emotions, of recognizing that there's certain emotions here. They come and they go and they vary in intensity. And that's part of being human. So we have many programs, as Laura said, that are helpful to people in learning the practice of mindfulness, because it is a practice. It's not something that you learn from reading in a book or talking to somebody about it or wishing for it. So we have many ways to practice, and that is oftentimes a really, I would say, in 24 years overall, that has been a very positive experience for our participants. So we welcome you at any time. Um, so I want to talk a little bit about what's happening in our COVID-19 world right now and how it affects us. I mean, you all know what's happening, but how it affects us is really normal, even though this is a totally abnormal time for us. Human beings have emotions, and we have a whole range of emotions. And sometimes those emotions are really strong, sometimes not so strong. And we don't actually choose how we feel at any given time. Emotions just arise. I mean, people don't choose to feel anxious or scared. We just do based on how conditions have come together in a certain way. And so, right now, conditions have come together in a way that really fans the flames of fear and anxiousness and dread and sadness and grief. And so it's important to remember that these are normal responses to a really abnormal and new experience for us in the world. And in the world is important because it reminds us how connected we are to everyone, even though they live halfway or further across the world than we do. And that's true every day, not just when there's a pandemic. People all over the world have the same human emotions that we have. And so it's something that connects us. And so I encourage you at this time to remind yourself that it's normal to feel what you're feeling. And also, it's normal to recognize that the pandemic isn't the only thing that's going on. Flowers are blooming in the spring. It's spring. Uh, People are connecting in ways that they maybe haven't ever before. There's still joy and beauty in the world. And it's an important time actually to seek that out and not miss the fact that in many ways life is normal, and in obviously some big ways it's very different for us. So I want to talk a little bit about stress. And again, stress is part of our lives, and we know a lot about how to relate to stress, or we wouldn't be alive. So we have this great system in our human bodies that helps us to stay alive. And that shows up in the face of what is often referred to as the fight, flight, or freeze reaction when we sense danger. And that's called acute stress. So acute stress can be mild. It can be something like we are driving down the road and a car pulls in front of us and we almost hit it, but we don't. So that was a moment of acute stress. We were in danger and it passed and we went on. Sometimes an example of acute stress is having a deadline. I had a little acute stress this week. And so that motivates us sometimes to get things done and to pay attention in certain ways. And so those things can be helpful. But again, this system was designed to keep us away from tigers and to keep us alert to danger and to be able to relate, to respond to that when it's here. And so right now there's some acute stress going on that isn't just mild, it's severe. Those of you who are on the front lines of healthcare, meeting people coming into the hospital because they may have the virus, that's acute. And measures have to happen really quickly, and people have to think fast and act fast. And a lot of adrenaline is kicking into the body. And that's part of what happens when we're stressed. It's the well-designed system. The heart pumps harder to get blood throughout the body so we can function. The muscles tense up so we can protect ourselves if the tigers are coming. The immune system is kicking out hormones to help us jump into the fray or get away from it. And so this is a really wonderful system. It helps us when we really need to respond to something quickly and protect ourselves or someone else. What happens though over time is if we don't have some relief from that, then it turns into chronic stress, and chronic stress causes lots of problems. It can create chronic conditions, or it can compromise the immune system so that conditions that we may not get otherwise we're more susceptible to. So in both acute or chronic stress, typical things that we might experience during that are a heightened sense of anxiousness or worry. We might experience changes in sleep or changes in eating patterns. We might be seeking out a lot of junk food, and we may feel more irritable, less tolerant. Um, we may turn to things that feel good, like alcohol or tobacco or other kinds of drugs, or binging on social media to try to get comfort from other people. And as you probably know, that there's a limit to that, how it can support us with that. So it's a really important time to be skillful and not reactive to how you care for yourself at this time. And not to just do that on your own. I mean, there's a lot that you can do on your own. And part of being wise about this is listening to yourself and knowing what is actually helpful to you right now, and trusting that. Trusting that if it's something that is actually healthy and good for you. Um, the other thing is to not just do this on your own, to reach out to family members or coworkers or friends for support, and to offer support to them as well. Because again, we're all in this together. So the other thing that is, I think, important to recognize in this, as we're feeling threatened and fearful, is to remember that life is impermanent. And being reminded of that right now may not, on the surface, feel um, helpful, but the truth is, it is impermanent. And so it reminds us that uh, it's deserving of wise attention in how we live, because we don't know how long we will live. And hopefully, all of us will live a long time. But we in healthcare know that that is not the case. And even if you're not in healthcare, you know that. So it's an important time to just reflect on how you want to live your life. And that's actually part of what's helpful about mindfulness, is it's actually about how we live our lives, and engaging in them with mm, wisdom and compassion and intentionality. So this is a time to reflect on that as well. So some very concrete things that you might consider are remembering to exercise, remembering to eat really healthy food, and ask for that at work as well as when you're making your own meals. But apples and oranges and bananas instead of cookies and donuts are really helpful at this time. Uh, Spending time outdoors, maintaining your connections to people, doing things that you enjoy, and making time for those, even if it's brief. If you're working extra hours, or you're really in the most uh, intensive realms of healthcare, making sure that you take breaks and supporting your coworkers in taking breaks. Working all the time does not equate to working well. So it's really important that people work together to make sure that everyone's getting time away from work as well. Staying updated on factual news rather than getting lost in people's opinions about the news, or their own versions of what's happening. And making sure that you are interacting with family and friends, even if you live alone and you're not interacting automatically in the same space, but reaching out to people. And of course, now it's mostly remotely, but making sure that you do that. I found myself reaching out to people that I haven't talked to for a long time just to see how they're doing, uh, particularly my friends in New York City. If you have children, it's important to talk to them about how they're feeling. And if they're aware of what's going on and feeling some stress about it, to also maybe talk to them about how you're handling your stress and not imposing it on them or giving them a lecture, but normalizing it for them as well, because everyone's routines and life have changed. So um, being cognizant that it's not just the big people here. So I'm going to um, invite you once again to stop. And again, you can close your eyes or leave them open. And just find the breath where you feel it easily. And as you come to the breath, really remembering that you don't have to do anything with the breath, you're just feeling it. And as you intentionally pay attention to the breath, you're unhooking over and over again, breath by breath, from all of the chatter in the mind, the to-do list, the frenzy of emotion that may be going on, other sensations in the body. Unhooking, not as in pushing away or resisting, but just choosing where you pay attention right now. And so right now it's on the breath and really feeling the sensations, not thinking about the breath. And noticing if there's some way in which you're automatically holding or clenching, to the extent possible, releasing that, maybe softening the shoulders, dropping the jaw a little bit, not trying to force anything. And now opening your eyes and knowing that you can do these two little practices that we did at the beginning and the end anytime, anywhere. And it can be for a few minutes or a few seconds. And each time you do it, it's a way of actually coming back into what's happening and interrupts that automatic reactivity that we're often operating on. And that presence and awareness of what's actually happening supports us in making wiser choices, and for ourselves as well as for others as we interact with them. So I wish you well, and I invite you to join us in the mindfulness-based stress reduction program, which is the first one that people do, or the mindfulness-based cognitive therapy program. And as Laura's going to tell you more about the resources that we have, those are you can find our website there. So thank you very much for taking the time to join me here today, and I wish you well. And I encourage you to wish yourself and the people you love and care about well, in addition to everyone else that is experiencing this difficult time in the world. Thanks.